Marcus sat in the sterile waiting room of Children's Hospital with his hands trembling slightly as he held a folder containing test results that would alter the trajectory of his entire life. His 8-year-old daughter Sophie had complained of persistent headaches for 3 weeks, and what he initially dismissed as ordinary childhood complaints had turned into something far more serious. The neurologist had asked to speak with him privately, which immediately sent a chill down his spine. He knew in that moment that the news would not be good, and he was right. Sophie had been diagnosed with a rare neurological condition called progressive cerebral cortex degeneration, a disease so uncommon that most general practitioners would encounter fewer than a handful of cases throughout their entire careers. The doctors explained that the condition would gradually affect her motor functions, cognitive abilities, and eventually her quality of life would deteriorate significantly. They used words like degenerative, progressive, and unfortunately, no cure. Marcus felt as though the ground beneath him had shifted. He had always been the type of person who believed he could solve problems through hard work and determination, but medicine did not operate on those principles. No amount of sleepless nights or extra effort would change the reality of what his daughter was facing. The lead neurologist, Dr. Patricia Chen, was compassionate but direct. She outlined a treatment plan that consisted primarily of managing symptoms and making Sophie as comfortable as possible as the disease progressed. Physical therapy would help maintain her mobility for as long as possible. Medication could ease some of the neurological symptoms, but there was no reversal. There was no stopping it. The disease would move forward on its own timeline, indifferent to hope or desperation or a father's willingness to give everything he possessed to change the outcome. Marcus asked every question he could think of during that appointment. Were there any clinical trials? Were there any newer treatments being researched? What about in other countries? What about alternative approaches? Dr. Chen answered each question with the same careful, measured tone. There were some experimental treatments in early stages of development, she said, but they were not yet approved for human trials. She warned him that parents in desperate situations sometimes pursued unproven treatments, and she wanted him to understand the risks involved. Children could be harmed by experimental procedures. False hope was a powerful thing, and it could lead families to make decisions they would deeply regret. She advised him to focus on the time he had with Sophie and to accept the situation with grace. Marcus left that appointment feeling completely hollow. He drove home in silence, unable to process what he had heard. Sophie was at her grandmother's house for the afternoon, which gave him a few hours to absorb the news before he had to face his daughter and explain that her life would never be the same. He sat in his home office and simply stared at the walls for a long time. That night, after putting Sophie to bed and telling her that the doctors wanted to help her feel better, Marcus did something he had not planned to do. He opened his laptop and began searching. He searched for information about progressive cerebral cortex degeneration, looking for anything that might provide some glimmer of hope. Medical journals appeared in his search results, academic papers written by researchers around the world. He read through abstracts and case studies. Most of the information confirmed what Dr. Chen had told him, but then he found something different. Deep in a medical research database, he discovered references to an experimental treatment being developed at a private research institute in Switzerland. The treatment involved a combination of targeted gene therapy and specialized stem cell cultivation, designed to regenerate damaged neural tissue. The research was in early stages, and the papers made clear that the procedure was far from proven. There had been no human trials yet. The animal testing had shown some promising results, but the leap from laboratory animals to human patients was enormous. The risks were substantial. The success rate was unknown because there was no success rate to measure. Yet Marcus read through every word he could find about this treatment. He read the methodology. He read the limitations noted by the researchers. He read the disclaimers and the cautions and the explanations of why this approach was still theoretical rather than practical. By 2 in the morning, Marcus had a folder on his computer filled with papers and articles about experimental treatments for rare neurological conditions. He had names and contact information for researchers working in this field. He had information about clinical trials happening in various countries. And he had made a decision, though he barely admitted it to himself at that point. He was not going to accept what the doctors had told him. He was not going to sit passively while his daughter's condition worsened. He was going to find another way, no matter what anyone cautioned him against. He was going to fight. He did not yet know where this path would lead him, nor could he have imagined the consequences, both positive and negative, that would flow from the choice he was making in the darkness of that night. All he knew was that Sophie was his daughter, and he would not give up on her. The warnings from medical professionals who had spent their entire careers studying these conditions suddenly felt less important than the quiet determination growing in his chest. He would pursue the experimental treatment. He would find a way to make it happen, and he would deal with the consequences of that choice when they came. Marcus spent the next 3 weeks in a state of obsessive research that consumed nearly every waking moment not devoted to caring for Sophie. He created a detailed spreadsheet tracking every piece of information he found, organizing contact details for researchers, treatment centers, and other families who had faced similar diagnoses. His wife Jennifer noticed the change in him immediately. She found him at his laptop late into the night, surrounded by printed medical papers and highlighted passages. When she asked what he was doing, he told her about the experimental treatment in Switzerland, and her reaction was not what he hoped for. Jennifer was a practical person by nature. She worked as an accountant and approached problems with logic and systematic thinking. She loved their daughter just as fiercely as Marcus did, but she believed that accepting difficult realities was more responsible than chasing what might be false hope. She reminded him of what Dr. Chen had said about desperate parents making poor decisions. She pointed out that the treatment was experimental, unproven, and potentially dangerous. She asked him how they would even afford such a procedure if they found a way to pursue it. Their insurance would never cover experimental treatment in a foreign country. The costs could be astronomical. They had savings, but not enough for something like this. And what if it did not work? What if it made things worse? What if they spent all their money and all their emotional energy on something that ultimately failed? Marcus listened to every concern Jennifer raised, and he understood the logic behind each one. But something had shifted inside him when he received Sophie's diagnosis. The rational part of his brain that understood probability and risk and realistic expectations had been overridden by a different part. The part that was a father, that could not accept that his 8-year-old daughter's life would be defined by decline and deterioration. He did not argue with Jennifer about it. Instead, he simply continued his research in quieter moments, learning as much as he possibly could about what might be possible. One of the turning points in his research came when he discovered an online support group for families dealing with rare neurological conditions. Marcus created an anonymous account and began reading through the discussions. There were parents who had received similar diagnoses for their children. There were adults who had been diagnosed with degenerative conditions themselves. There were stories of treatments attempted, some that had shown promise, some that had failed. And there were people who had learned about experimental treatments being developed in various parts of the world. Through this online community, Marcus connected with a woman named Alina, whose 12-year-old son had a similar condition. Alina had spent 2 years researching options and had eventually made contact with the research institute in Switzerland that Marcus had found in his searches. She agreed to speak with him through a private message, and over several weeks, they built a cautious friendship based on their shared experience of navigating a medical crisis with limited options. Alina told Marcus about her journey. She had been in the same place he was now, desperate and searching for any possibility beyond the bleak prognosis her doctors had given. She had eventually contacted the Swiss Research Institute directly, explaining her son's condition and asking if there was any possibility he might be considered for their experimental program. To her surprise, they had responded. The researchers explained that they were beginning preliminary human trials for certain conditions, and her son's particular presentation of symptoms made him a potential candidate. However, they needed parents to understand the full scope of the risks involved. There was no guarantee of success. There were potential complications that could occur. The procedure was unlike anything available in traditional medicine. Alina had made the decision to pursue it. She and her family had relocated temporarily to Switzerland. Her son had undergone the treatment 2 years earlier. She told Marcus that the experience had been more difficult than she could have imagined. The procedure itself was complex and invasive. The recovery period was long and uncertain. There were moments when she questioned whether she had made a terrible mistake, but she also told him something else. Her son's condition had stabilized. It had not been reversed completely, but the progressive degeneration had stopped. He was able to continue his education. He was able to play and laugh and grow in ways that would not have been possible if the disease had continued on its expected course. Marcus felt something shift inside him as he read Alina's message. He was not delusional about the risks, but knowing that someone had actually pursued this path and that their child had experienced positive results changed something fundamental in how he viewed his own situation. Alina offered to help him navigate the next steps. She provided him with the contact information for the research institute. She warned him that the process of being evaluated as a candidate would be lengthy and complicated. She told him to prepare Jennifer for the possibility that this might actually happen. Over the following weeks, Marcus began reaching out to other families through the support group who had pursued experimental treatments. Some had positive stories, some had devastating ones. Some had stories that were complicated and mixed, with benefits and drawbacks that did not fit neatly into categories of success or failure. He listened to all of them. He asked detailed questions. He tried to understand not just the medical outcomes, but the emotional and financial and relational costs of pursuing these paths. He also expanded his research to look at the actual scientists and researchers working on these treatments. He wanted to understand their credibility and their motivations. Were they legitimate researchers working for recognized institutions, or were they operating outside the bounds of established medicine? Were they driven by genuine scientific inquiry, or were they exploiting desperate families? He dug into their publications, their affiliations, their track records. The more he learned about the team at the Swiss Institute, the more convinced he became that they were legitimate researchers doing serious work on a difficult problem. Marcus finally shared everything he had learned with Jennifer. He showed her the research, the contacts, the stories from other families. He told her about Alina and her son. He explained what he was thinking of doing. He wanted to contact the Research Institute formally and ask if Sophie might be evaluated as a candidate for their program. Jennifer listened without interrupting, and when he finished, she asked him a simple question. What did he need from her? Not whether she agreed, not whether she thought it was a good idea, but what did he need from her going forward? Marcus realized in that moment that his wife was not going to stop him. She was scared. She remained skeptical. But she loved him and she loved their daughter, and she was willing to take this journey with him even if she did not fully believe in it. That support, offered with reservation but offered nonetheless, gave Marcus the courage to make his next move. Marcus composed the email to the Swiss Research Institute on a Tuesday evening in March, nearly 2 months after Sophie's initial diagnosis. He drafted it multiple times, deleting and rewriting until he found the right balance between providing complete medical information and conveying the urgency of his situation without sounding desperate or demanding. He included Sophie's medical records, the results of her neurological tests, detailed descriptions of her symptoms, and a personal narrative explaining how her condition had progressed since diagnosis. He hit send before he could second-guess himself, and then he closed his laptop and sat in silence. The response came 3 weeks later. The Research Institute, led by Dr. Klaus Hoffmann, a neurologist who had spent 25 years studying degenerative conditions, expressed cautious interest in Sophie's case. They explained that they were in the early stages of human trials and that Sophie's particular presentation of symptoms aligned with their research parameters. However, before any procedures could be considered, Sophie would need to undergo a comprehensive evaluation at their facility. This evaluation would take several days and would involve extensive testing to ensure that the treatment approach would be appropriate for her specific condition. They also asked to speak directly with Dr. Patricia Chen to review Sophie's care and to understand the full medical picture. Marcus called Dr. Chen and asked for a meeting. He told her what he had discovered and what he was planning to do. He asked her to share Sophie's complete medical file with the Swiss Institute. Dr. Chen's reaction was one of disappointment mixed with understanding. She had encountered families in this situation before. She knew that no amount of discouragement would change his mind. She told him clearly that she did not believe this was a wise course of action, but she also recognized his right as a parent to make decisions about his daughter's care. She would provide the medical records, but she also wanted to speak with him about the risks one final time. They sat together in her office on a Friday afternoon. Dr. Chen explained in detail what could go wrong with an experimental procedure. Even if the treatment concept was sound, the execution in a human patient could reveal unforeseen complications. There could be infections. There could be allergic reactions or adverse responses to the medications used in the procedure. There could be permanent damage to neural tissue. There could be cognitive effects that would not become apparent immediately but would develop over time. She also addressed the psychological and emotional risks. If the treatment failed, Marcus and his family would not only be dealing with Sophie's ongoing condition, but also with the guilt and regret of having pursued an unproven intervention. That emotional burden could be as damaging as any physical complication. Marcus listened respectfully. He understood everything she was saying, and he did not dismiss her concerns as unfounded. But he also asked her a different question. If Sophie were her own child, and if she had explored every conventional option and found nothing but decline ahead, would she truly do nothing? Would she simply accept the prognosis and watch her child deteriorate? Dr. Chen paused for a long moment before answering. She said that she would like to believe she would accept reality with grace, but she was honest enough to admit that she did not know what she would do if faced with that choice. She told him that she hoped he knew what he was doing, but she also said that she would continue to provide Sophie with the best supportive care possible, regardless of what decision he made about the experimental treatment. Over the following month, Marcus prepared for the evaluation at the Swiss Institute. The process required significant planning. He would need to take time away from work. Jennifer would need to arrange time off as well. They would need to find someone to care for their other child, a 12-year-old son named David who was struggling with the reality of his sister's illness. Marcus's parents offered to stay with David while they were away, and they also offered financial help for the trip. Jennifer's parents were less supportive. They called Marcus directly to express their concerns about what they called his reckless pursuit of false hope. They asked Jennifer if she had tried to talk him out of it. The tension in the family was becoming palpable. Jennifer herself was having moments of doubt, though she tried not to express them to Marcus. One evening, she found him in Sophie's bedroom watching her sleep. Jennifer sat beside him on the edge of the bed and asked him directly if he was certain about this. Marcus said that he was not certain about anything except that he could not live with himself if he did not pursue every possibility available to him. Jennifer took his hand and said that she understood, and then she told him something that surprised him. She had called Alina, the woman Marcus had been corresponding with through the support group. She had asked Alina every difficult question she could think of about the treatment, the recovery, the outcomes, the emotional toll. Alina had been honest about everything, including her own moments of regret and fear. But Alina had also told Jennifer something that seemed to matter. She had said that whatever happened with her son's treatment, she would always know that she had fought for him, that she had refused to accept a predetermined future without exploring other options. Jennifer said that she understood that feeling now, and she was committed to supporting Marcus and Sophie through this process. 2 weeks before they were scheduled to travel to Switzerland, Sophie began asking questions about why she was going to see doctors in another country. Marcus and Jennifer had been careful not to discuss the experimental treatment in front of her, but children are perceptive, and Sophie had noticed the changed dynamic in her household. Marcus sat down with her and explained in age-appropriate language that the doctors in Switzerland were doing special research to help children with conditions like hers. They wanted to learn more about her and to see if they could help her feel better. Sophie asked if it would hurt. Marcus said that yes, there would probably be some discomfort, but he and her mother would be there the entire time. He also told her something important. He said that the doctors were not sure if the treatment would work, and he needed her to understand that they might go through all of this and not get the results they hoped for. Sophie, with the simple wisdom of children, asked if trying something and having it not work was better than not trying at all. Marcus realized that his 8-year-old daughter had just articulated the core of his entire philosophy. The week before their departure, Marcus made a decision that surprised even himself. He decided to tell his extended family and some close friends what they were planning to do. He felt like he was announcing something radical or dangerous, but when he actually spoke the words aloud to people he trusted, he found that many of them responded with support and understanding rather than judgment. Some expressed concern, yes, but others offered encouragement. His best friend from college, a man named Robert, told him that he admired his willingness to fight for his daughter even when the odds were uncertain. Several colleagues from work expressed their support and assured him that his job would be waiting for him when he returned. Jennifer booked the flights. Marcus requested a leave of absence from his job, explaining only that there was a family medical situation that required his attention. They began packing. They prepared David for the week he would spend with his grandparents. They said goodbye to Sophie's school and her teachers, telling them that she would be away for medical evaluation. And then, on a cold morning in late April, Marcus and Jennifer and Sophie boarded a plane to Switzerland, carrying with them all their hope and fear and determination, not knowing what they would find when they arrived. The Research Institute was located in a modern facility outside Zurich, situated in a landscape of rolling hills and carefully maintained gardens that seemed designed to provide some measure of peace to families arriving in crisis. Dr. Klaus Hoffmann greeted them personally, a man in his 60s with gray hair and kind but serious eyes. He explained that the initial evaluation would take 3 days and would involve comprehensive testing to confirm that Sophie was an appropriate candidate for the experimental procedure. The testing included advanced neuroimaging, genetic analysis, cognitive assessments, and physical evaluations. It was exhausting for Sophie and emotionally draining for Marcus and Jennifer, who watched their daughter undergo procedure after procedure while trying to maintain reassuring expressions on their faces. The evaluation revealed something unexpected. Sophie's condition was more advanced than her initial diagnosis had suggested. The degeneration in her neural tissue was progressing faster than typical for her condition. This was actually good news in some ways, because it meant that intervention sooner rather than later made more sense. But it also meant that Sophie was experiencing more significant neurological compromise than they had fully understood. Dr. Hoffman explained this to them carefully, and Marcus felt a wave of guilt wash over him for not having pursued this evaluation sooner. After the 3-day evaluation, Dr. Hoffman called them into his office for a consultation. He explained in meticulous detail what the experimental treatment would involve. The procedure had 2 main components. The first was targeted gene therapy designed to halt the progression of the neural degeneration. The second was the introduction of specially cultivated stem cells that had been treated to differentiate into the specific types of neural tissue that were damaged in Sophie's brain. The procedure would require surgery, which carried inherent risks. There would be a recovery period of several weeks, during which Sophie's condition could fluctuate unpredictably. Some patients experienced temporary worsening of symptoms during the recovery phase. Others showed initial improvement followed by periods of stagnation. The outcomes varied significantly from patient to patient. Dr. Hoffman was careful not to overpromise. He explained that this was experimental treatment, and while the preliminary results in animal models had been encouraging, human outcomes remained uncertain. He presented the consent forms, which were extensive and detailed every possible complication and risk. Marcus and Jennifer read through them together, and it was Jennifer who asked the question that Marcus had been afraid to ask. If the treatment went wrong, if it caused significant harm to Sophie, what recourse did they have? Dr. Hoffman answered honestly. The treatment was being conducted under strict ethical guidelines and institutional review board oversight, but the family was accepting significant risk by pursuing an experimental intervention. If complications arose, they would receive the best medical care the institute could provide, but liability was limited. They were essentially trusting the institute and the medical team with their daughter's well-being without legal guarantees of outcomes. They signed the consent forms on a Thursday afternoon. The procedure was scheduled for the following Monday. That weekend was one of the longest of Marcus's life. He and Jennifer took Sophie to the gardens surrounding the facility. They walked through flowers and along pathways, and Sophie seemed almost oblivious to the fact that in 3 days she would undergo a complex surgical procedure. Children, Marcus realized, experience time differently than adults. To Sophie, 3 days ahead might as well have been 3 years. She lived in the present moment in a way that her parents could not seem to manage. The night before the surgery, Sophie could not sleep. She came to the hotel room where Marcus and Jennifer were staying and asked if she could sleep between them. They made room for her, and the 3 of them lay together in the darkness. Sophie asked if the surgery would hurt. Marcus told her that she would be asleep during the surgery, so she would not feel anything while it was happening. She asked if she would feel it afterward. Marcus said that yes, she probably would feel some discomfort afterward, but the doctors would give her medicine to help with that. Sophie was quiet for a long time, and then she asked if her brain would be fixed. Marcus felt tears forming in his eyes. He told her that the doctors were going to try very hard to help her brain feel better, and that he and her mother would be right there with her the whole time. The surgery began at 7 in the morning. Marcus and Jennifer were taken to a waiting area while Sophie was prepared for the procedure. The surgery lasted 8 hours. Every hour felt like a day. Marcus paced. Jennifer sat and prayed, though she was not typically a religious person. They barely spoke to each other because there was nothing to say that would make the time move faster or the uncertainty feel more bearable. When Dr. Hoffman finally emerged from the surgical suite, his expression was carefully neutral. The surgery had gone as planned. There had been no unexpected complications during the procedure itself. Sophie was in recovery and would remain sedated for the next several hours to allow her body to begin the healing process. They were allowed to see Sophie in the recovery room. She looked impossibly small in the hospital bed, with tubes and monitors attached to her body. Her head was partially bandaged from the surgical site. Marcus held her hand and watched her sleep, and he found himself praying as well, something he had not done since childhood. He prayed that the procedure would work. He prayed that Sophie would recover without complications. He prayed that this nightmare would transform into something that could be understood as a victory rather than a terrible mistake. The first week of recovery was fraught with complications that tested every ounce of Marcus's resolve. On the 3rd day after surgery, Sophie developed a fever. The doctors explained that some fever was expected as the body responded to the surgical trauma, but they needed to monitor it carefully to ensure it did not become a serious infection. Sophie was miserable, uncomfortable, and feverish, crying from pain and confusion about what had happened to her body. She asked Marcus repeatedly when she could go home. He sat beside her bed and held her hand and told her that she had to give her body time to heal, but the words felt hollow and inadequate. On the fifth day, Sophie experienced a seizure. It was brief, lasting only a few minutes, but it was terrifying for Marcus and Jennifer to witness. The medical team responded quickly, administering medications to prevent further seizures and monitoring her neurological status closely. Dr. Hoffman explained that seizure activity was not uncommon in the immediate post-operative period following brain surgery, especially in the context of experimental procedures. It did not necessarily indicate that something had gone catastrophically wrong, but it did mean that Sophie's neurological system was highly reactive and unstable. By the second week of recovery, Sophie's fever had resolved and the seizure activity had decreased, but she seemed to have regressed cognitively. She was more confused than she had been before the surgery. She had difficulty with basic tasks that she had been able to perform before. When Jennifer mentioned this to Dr. Hoffman, he explained that some cognitive fluctuation was expected during the recovery phase. The brain was responding to the surgical intervention and to the introduction of new cellular material. It would take time for the neural system to integrate and adapt. This could take weeks or even months. Marcus began to doubt himself. He wondered if he had made a terrible mistake. He looked at his daughter struggling with basic cognitive tasks and thought about Dr. Chen's warnings about the risks of experimental treatment. He found himself in the hospital hallway, unable to contain his anxiety, wondering if he had harmed his daughter in the name of hope. Jennifer found him there and did not try to convince him that everything would be fine. Instead, she sat beside him and told him that whatever happened next, they had done what they believed was right. They had not accepted a predetermined future without exploring other options. Whatever came now, they would face it together. By the third week of recovery, something began to shift. Sophie's cognitive symptoms started to improve. She became more alert, more aware of her surroundings. The pain decreased, and she required less medication. She began to engage in conversation again, to ask questions, to show interest in things around her. And something else began to happen as well. The tremors in her hands, which had been present since her initial diagnosis and had been worsening, seemed to stabilize. They did not disappear completely, but they no longer seemed to be progressing. Dr. Hoffman examined her carefully and told them that the initial indicators suggested that the procedure might be having the intended effect. The degeneration seemed to have halted, but he cautioned them that it was still too early to draw firm conclusions. They would need to monitor her carefully over the coming months and years to understand the true outcome of the treatment. 6 months after the procedure, Marcus and Jennifer brought Sophie back to the Research Institute for comprehensive follow-up evaluations. The testing was extensive but considerably less invasive than the initial assessment. Dr. Hoffman reviewed the results with them over several hours, methodically walking through each measurement and comparison. The neuroimaging showed that the gene therapy had successfully halted the progressive degeneration. The stem cells had integrated into Sophie's neural tissue and had begun to function as replacement neural cells in the damaged areas. Most importantly, the cognitive and motor testing showed that Sophie's condition had stabilized. She was no longer declining. Her neurological function had plateaued at a level that, while not completely normal, was dramatically better than the trajectory she had been on before the treatment. Dr. Hoffman also shared something unexpected. Sophie's case was not the only success story. 2 other patients who had received the treatment before Sophie had similarly positive outcomes. The preliminary results, while still limited in scope, were promising enough that the institute was moving forward with an expanded clinical trial. They wanted to treat more patients, gather more data, and work toward eventually seeking regulatory approval for the procedure. They asked if Marcus and Jennifer would be willing to participate in ongoing follow-up studies and to allow Sophie's case to be documented as part of the research. Marcus agreed immediately, understanding that allowing Sophie's story to contribute to medical knowledge might help other families facing similar situations. The return to normal life was complicated in ways that Marcus had not anticipated. When they arrived back home, David barely recognized his sister. Sophie had changed significantly during their months away. She was physically weaker from the surgery and recovery process, requiring physical therapy to rebuild her strength and coordination. She tired more easily than she had before. But her mind was engaged and active in ways it had not been for months. She could concentrate on schoolwork again. She could play and laugh without the fog of illness that had been surrounding her. The tremors in her hands were minimal and seemed to be stable rather than progressive. School presented new challenges. Sophie's teachers needed to understand what she had been through and what her current capabilities were. Marcus met with the school administration and explained Sophie's situation. He was honest about the experimental nature of her treatment, but he also provided documentation of her improved condition. The school agreed to allow Sophie to return to classes while providing support services to help her rebuild her academic skills after months of absence. Her classmates, who had learned that she had been seriously ill, welcomed her back with genuine warmth and curiosity about her experience. Dr. Patricia Chen was surprised when Marcus scheduled an appointment with her to provide an update on Sophie's condition. He brought imaging studies and documentation from the Swiss Institute showing the halt in neural degeneration. Dr. Chen reviewed the materials carefully, and Marcus could see the conflict playing across her face. She had warned against this path, and yet the outcome seemed to validate Marcus's decision. She asked him detailed questions about the procedure and the recovery process. She expressed genuine interest in the scientific basis of the treatment and the mechanisms by which it appeared to be working. By the end of the appointment, Dr. Chen told Marcus something that moved him deeply. She said that while she still believed experimental treatments carried significant risks, Sophie's outcome had challenged some of her assumptions about the limits of what was possible. She asked if the Swiss Institute would be willing to communicate with her about their expanding clinical trial. She wanted to learn more about their protocols and their findings. This conversation with Dr. Chen proved to be the beginning of a larger shift in the medical community's approach to rare diseases. Dr. Chen began reaching out to other neurologists and pediatricians in her network, sharing information about the Swiss Institute's work and Sophie's positive outcome. A prominent medical journal published a detailed case study of Sophie's treatment and recovery, written by both Dr. Hoffman's team and Dr. Chen, presenting a balanced assessment of the risks taken and the results achieved. The article sparked discussion in medical circles about the ethics of experimental treatments and the responsibility of the medical community to pursue innovative approaches when conventional treatments offered only decline and deterioration. Word of Sophie's case spread through the rare disease community. Parents who had received bleak diagnoses for their own children reached out to Marcus, asking for information about the treatment and advice about pursuing it. He responded to each inquiry carefully, explaining what had worked for Sophie while acknowledging that outcomes could vary significantly from patient to patient. He began connecting families with resources and information, and he started thinking about creating a more formal support network for families pursuing experimental treatments for rare diseases. 2 years after Sophie's initial treatment, Marcus received a call from Dr. Hoffman. The expanded clinical trial had produced remarkable results. Of the 12 patients treated so far, 11 had shown significant stabilization or improvement of their conditions. One patient had not responded as hoped, but even in that case, the treatment had not caused the severe complications that had been feared. The results were strong enough that the Institute was preparing to seek regulatory approval from the European Medicines Agency for the procedure. Dr. Hoffman asked if Marcus would be willing to serve on an advisory board that would help guide the regulatory process and future development of the treatment. Marcus accepted without hesitation. The regulatory approval process took another 3 years, but in the 5th year after Sophie's initial treatment, the procedure received formal approval in Europe for treating specific categories of progressive neurological conditions. The approval came with strict guidelines about patient selection and informed consent, but it meant that the treatment was no longer purely experimental. It was now considered a viable medical intervention, available through approved centers under specific circumstances. Other research institutes around the world began developing similar approaches, building on the work that Dr. Hoffman's team had pioneered. Sophie, now 13 years old, was thriving academically and socially. The tremors in her hands were minimal and stable. She had returned to playing the violin, something she had feared she would never be able to do again. She knew her own story and understood that she was part of something larger than herself. She had become passionate about science and had begun talking about wanting to study medicine or neuroscience when she got older, inspired by her own experience of illness and recovery. Marcus and Jennifer founded a non-profit organization dedicated to supporting families with rare neurological conditions and connecting them with information about emerging treatments. They worked with patient advocacy groups, medical institutions, and researchers to improve access to information and to help families navigate the complex landscape of experimental medicine. The organization grew to include support groups, educational resources, and a directory of active clinical trials for rare conditions. The most significant systemic change, however, came in how medical schools and residency programs approach the study of rare diseases. Several medical institutions began incorporating case studies of rare disease management into their curriculum, using Sophie's case as a primary example. The lesson was not that doctors should approve every experimental treatment patients requested, but rather that the medical community needed to balance appropriate caution with genuine exploration of innovative approaches. Medical students learned about the importance of listening to patients and families, of acknowledging the limits of current knowledge, and of working collaboratively with researchers to pursue possibilities that conventional medicine could not offer. Dr. Chen became an advocate for what she began calling compassionate innovation in medicine. She published articles discussing the ethical framework for considering experimental treatments when conventional options offered only decline. She argued that the medical community had a responsibility not just to avoid harm, but also to help patients and families explore legitimate paths toward hope when those paths were available. She and Marcus became colleagues and friends, working together on various initiatives to improve how rare diseases were diagnosed and treated. 10 years after Sophie's initial diagnosis, Marcus stood in front of an auditorium of medical professionals at a conference on rare neurological diseases. He had been invited to speak about his family's experience and the impact it had on the medical community. He began by talking about the moment when Dr. Chen had told him that there was no cure, no hope, nothing to do but accept decline. He talked about the warnings he had received, the people who had told him he was making a mistake. He talked about the fear and uncertainty of pursuing an experimental treatment. And then he talked about where Sophie was now, flourishing as a teenager with a stable condition, planning a future that had once seemed impossible. He told the audience that his experience had taught him something important about medicine and hope. He said that there was a difference between false hope, which ignored reality and pursued treatments with no scientific basis, and legitimate hope, which was grounded in genuine research and pursued with eyes open to the risks involved. He argued that the medical community had a responsibility to distinguish between these two types of hope, and to help patients and families pursue the latter while protecting them from the former. Marcus concluded by saying something that brought tears to many eyes in the auditorium. He said that he could not have known when he made the decision to pursue experimental treatment whether it would succeed. He could not have known that Sophie would be among the patients who benefited significantly from the procedure. But he did know that he could not have lived with himself if he had not tried. He knew that accepting a predetermined future without exploring legitimate alternatives was not medical wisdom. It was capitulation. And while not every experimental treatment would work out the way Sophie's had, the willingness to explore possibilities with appropriate caution and rigor was what advanced medicine and saved lives. The speech was widely shared in medical circles and became part of the conversation about how the medical community should approach rare diseases and experimental treatments. Sophie, sitting in the audience, watched her father speak and felt proud of him for finding the courage to challenge conventional wisdom. She thought about her own future and about how her experience might one day help other children facing diagnoses that seemed hopeless. She thought about how her father's refusal to accept what he was told could not be changed had transformed not just her own life, but the lives of countless other people who would benefit from the changes he had helped inspire in how medicine approached rare diseases. In the years that followed, Sophie grew into a young woman who wanted to become a neuroscientist. She worked in Dr. Hoffman's laboratory during the summer after her senior year of high school, analyzing data and learning about the ongoing research into neural regeneration. She published her first scientific paper, co-authored with Dr. Hoffman and other members of his team, before she even graduated from high school. When she was accepted to universities around the world to study neuroscience, she chose to attend a program near Dr. Hoffman's institute, allowing her to continue her collaboration with the research team that had changed her life. Marcus often reflected on the choice he had made that night in his home office when Sophie was first diagnosed. He had chosen to fight rather than accept. He had chosen to pursue hope rather than embrace despair. That choice had been frightening and uncertain, and it had worked out in ways that he could not have predicted or controlled. But it had also rippled outward in ways that mattered, changing not just his daughter's life, but transforming how an entire medical field approached the challenge of rare diseases. He thought often about the families whose children would benefit from treatments developed because of the path that Sophie had pioneered, and he felt a deep sense of gratitude that he had had the courage to defy conventional wisdom and follow his instinct to keep fighting for his daughter. Like, share, and subscribe, don't miss it.